Thank you for showing up today. I appreciate y'all. Oh, this has me here as the attendee, but the host is actually going to make me a panelist. I think I was in as a panelist and an attendee. So while he is doing that, I want to invite you to grab some paper and grab your pencils so that you can take notes and ask some questions. So my host is making me a panelist right now, and then in just a moment, I'm going to be sharing my screen. So let me know when you're able to see the presentation. Give me a thumbs up. Okay, very good. All right, awesome. Give me just a second. So I'm going to do gallery view. Okay, very good. Okay, welcome to the Full Circle Women's Care Practice and Pregnancy Orientation. I'm your host, Dr. Adams. Some of you had your history visits with me today, and some of you will have them maybe on Friday or next week. Some of you were scheduled for this to happen last week, but I was actually covering a hospital shift, and so I wasn't able to do the webinar then. So thank you for watching your emails and seeing that the Zoom meeting was moved. We have a couple of housekeeping items first. One, this is all confidential, so please feel free to use the chat function to ask me questions in real time. I'm happy to answer those. I also have some poll questions hidden throughout here, so please feel free to participate. And then if you have to hop off at any point during the webinar, just know that that's just fine. The rest of this presentation will be available on our YouTube channel for the duration of your pregnancy. All right, so let's start with looking at poll questions. Let me know. And someone told me last time that if you're doing this on a mobile, you may not be able to answer the poll questions. So I'll understand that. But we're going to start out with an example of what our poll questions look like. Are you a first-time mom or are you a mommy veteran? And so if you're able to see the poll and answer it, then you do that while I'm giving this little stretching talk. And then I say, and polls are closed. And I end the poll, and then I share the results with myself first, and then I share them with you. So this time we have more mommy veterans on the line than we have first-time moms. And you answering the polls actually does kind of help me to know what, how to pose the next part, what things to emphasize. So with the first-time moms there, we'll go through everything the way that we usually do. And for veteran moms, it's not your first rodeo, but it's a good refresher on everything from your previous pregnancies. So today we're going to go through the full circle experience, which includes where we deliver. We'll talk about some office protocols, like how to reach us, our office hours. We'll go through what to expect at your pregnancy visits. I'm going to give you a ton of prenatal resources. We will go in depth on exercise and nutrition in pregnancy, and then we'll end with an upper respiratory illness update. So first, a little bit about the philosophy of our practice. We are a collaborative midwifery model practice, which operates under the auspice that pregnancy and birth are normal life processes, not some disease that you've contracted that we have to cure you from. This is normal, it's physiologic. In the traditional midwifery model, though, they only care for normal, low-risk women, and if they identify some abnormality, like certain thyroid issues, high blood pressure, baby's breech, gestational diabetes, you have to leave the midwives to transfer out in order to be able to access a physician. In the collaborative model, we still have midwives doing the care, and it allows you to stay in the care of the midwives for labor and delivery, but you're under physician direction for any issues that occur with the pregnancy. So to that end, most of our labors and deliveries that are normal and low risk are attended by our certified nurse midwives, who you'll get a chance to see in just a moment. But if there is something outside of the scope of midwives where we deliver, there are board certified OBGYNs who are in-house 24 hours a day for true emergencies. If it is something urgent, like your labor has stalled and you need to have a C-section, or baby's not coming down and maybe need a vacuum delivery, then they call one of us. And the full circle physicians are always on call backing up our midwives. True emergencies, I know everybody says they had an emergent delivery, but true emergencies are when you don't have 5 minutes. And for those emergencies, like to put it in perspective, in 2024, we did over 600 deliveries, and 4 times the hospitalists were called. And I will say 3 of those 4 times were not emergencies because something bad was happening, but emergencies that no one from our practice was able to make it to the hospital fast enough because she showed up 10 centimeters without calling ahead. So that we'll talk about calling ahead in just a little bit. So where do we deliver? We deliver at HCA Hospital, formerly known as Memorial, which is over on University Boulevard. It's less than 10 minutes away from our office. We've been there since October of 23, and it has been a tremendous move for those of you who know us from delivering at Ascension, where we were for the 9 or 10 years prior to that. If you are interested in seeing the facility, which I highly recommend, they do have quarterly stork tours. So the stork tour is a big like baby shower kind of situation where they do giant group tours. They raffle off prizes. There's food. The director of women's services comes and talks to you. You get to meet like a bunch of people at the same time. If those don't work, the dates are actually listed in the rooms. We just had one in February, and so the next one's going to be in May. If those dates don't work for you, you can go to the HCA website, click on register for a class, and you'll see labor and delivery tour listed as one of the classes. So then you just pick a date. They do those twice a month. Those are obviously smaller group. Like I think she takes like 7 to 10 people at a time. And you can go and see where you're going to meet your little one or little ones. Our office is open Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch from 1 to 2. And then we reopen at 2 and we're open until 5. So if you call us between 1 and 2, you're going to get you've reached the after hours line for Full Circle Women's Care. It's not, the phones aren't broken, but we do that because the after hours line actually connects to the midwife on call. So the person on call will get these messages in case you're having a medical emergency. So she doesn't take administrative messages. So we ask that you don't leave those on the line between 1 and 2. Just wait until 2 and give us a call back. If you're having a medical emergency, definitely follow the prompts to reach someone so that she can bring you in if needed. On Fridays, we open from 9 a.m. and we close at 1 p.m. and we don't reopen in the afternoon. So if you're calling with something administrative on a Friday at 12:53 p.m., then we might have to address that when we reopen on Monday at 9 a.m. We do not have walk-in appointment slots. Our goal is to see you at as close to your appointment time as possible. And we cannot do that if I promise you the 10:20 appointment and someone decides to walk in at 10:07 saying, I need to be seen right now. That's not fair to you because you blocked off time to come in and see me at 10:20, and I should show your schedule the same respect. We do have some limited same-day appointments because there are some people who deliver or forget they had an appointment or later have to cancel. And so sometimes if you're calling in the morning and saying, hey, I have an issue, I think I need to be seen today, front desk can look at the schedule and say, hey, we actually have an 11:40 opening. Let's go ahead and put you in that. Because again, our goal is to keep the day as organized as possible. Now, if it is something urgent, say you're calling at 9:30 and saying, I'm not feeling my baby move, but our only open slot is at 3:20, we're not going to have you sitting there waiting 6 hours to get into our schedule. We might recommend that you go to labor and delivery to be seen. If you're having chest pain, we're going to tell you to go to the emergency room or an urgent care to be seen. And that's not us saying that we don't want to see you. It's us agreeing that what you have is an urgent matter, something that is best addressed in an urgent care setting and not sitting in our lobby waiting to be worked in. When you call, the providers are not able to leave patient appointments to take phone calls because, again, the time that you've scheduled to be with us is your dedicated time that we're not going to spend talking to someone else. And so when you call, we are in visits with other patients who deserve to have their dedicated time as well. When you do call, though, please leave a message in order to get a call back. Because some people do call and they hang up and they call and they hang up and they call and they hang up. And if you have listened to our message when you first call, people who say, well, I can never get anyone on the phone. You have to listen all the way to the end because it then tells you if you need to reach the front desk to press 0. That's how we know people listen all the way to the end. So whom do you ask for when you do reach front desk? If it is something related to pregnancy administration, like letters, disability forms, FMLA, that sort of thing, Jennifer and Kylie kind of tag team that role. And if you're calling with a clinical concern, I'm wondering, is this preterm labor? Do I have a urinary tract infection? You know, those they field those calls and they get them to the midwife on call to get an answer for you. A lot of the things they can answer because we get the same questions over and over again here. But as I said, if there's something beyond their scope, they can reach one of the providers. Our OB clinical coordinator is Naisha, and she's the one who handles any referrals. She also schedules things for you. So if you need to have a consultation with the anesthesiologist, go see the high-risk doctors, hematologists, whomever, Naisha is the one who does all that. And then at the end of pregnancy, if you need a belly birth scheduled, aversion and induction, she's your girl. And then many of you have already met with Renee Hall. She's the one who had you scan that QR code so that you could join me here. If anything changes about your insurance throughout pregnancy, you want to reach out to Renee because she will be the one to help you. Like say you've been paying on your deductible here, but then you have an ER visit and you meet your whole deductible. Don't keep paying on your deductible here then. Talk to Renee. She can check on your accumulations and then we may be able to adjust the prepayment plan. After hours, there is always someone from our practice on call for our practice. This is the person who is physically in the hospital, taking care of patients, rounding, delivering, that sort of thing. So she is the one who is taking care of emergencies. So she's not one to call to say, hey, I need a refill on my prescription. She's someone you call if you think you need to go to the hospital. When you reach us, like when you call after hours, you'll follow the prompts and leave your message. You have to leave a voicemail again in order to receive a call back. The phone doesn't even register that a call comes through unless a voicemail is left because people accidentally pocket dial their gynecologist at 3 a.m. all the time. You'd be very surprised. The patient portal is also another way to reach us, but please remember that response times can take up to 2 business days. So if you send a message on a Thursday, next business day is Friday, next business day is Monday. If it's a non-action item, like just wanted you guys to know this, you might not get a response back. We might just forward it to the person who's going to see you at your next appointment, especially if your appointment is coming up within 2 business days. So the portal is best used for things that are an action item, like I lost my lab slip. And the portal now has a function where we can upload your lab slip to the portal so that you can get it from us that way. Or let's say you have an upper respiratory infection and you need to convert your appointment to virtual, definitely give us a call about that. But patient portal is not for urgent matters. Please, please, please do not send, I'm worried because my blood pressure is extremely high. If you send that on a Thursday and I don't see it until Monday, that is dangerous. You're not feeling your baby move. If you're bleeding heavily, those are not portal messages. Please, please call the after hours line because that's something that needs our immediate attention. We ask you not to send blitz messaging, which is where you cut and paste the same message to 7 different providers. We've had people, upset they come to go to their pharmacy and there are 5 different prescriptions waiting for them, but it's because they've messaged 5 people who all really want to help you. But also the portal is something that we do after we've seen patients all day, sometimes host a webinar, and then go review all of our charts and our labs and release everything out to the portal. The portal is what we do at the end if we can do one more thing to make your day easier, but really what we want to do is spend some time with our families. So if it can wait until you have a visit, then we would love for it to wait until you have a visit. We ask that you don't try to have an appointment over the portal. So if you are asking things like, what are the pros and cons of this? What are the risks and benefits of that? That's an appointment. So we ask you to start a text thread with yourself, text yourself those types of questions, or schedule an appointment, because you don't have to just have appointments on your regular set schedule if you have questions that can't wait for until your next visit is due and you really want to talk through some things. But we would like to do it during the regular business office hours day. Ultrasounds are also released on the patient portal unless there's something urgently abnormal about it. In that case, we will not let you leave the building. That's the one time that we will break our schedule. We'll find someone to go over the ultrasound with you and make a plan for what was seen. Otherwise, we don't have your results immediately. We don't have your report immediately on the same day. So we get the medical assistants have to get them off of the ultrasonographer's machine and then upload them to our electronic medical record system, divide them among us. So then give us 2 business days to receive them, review them, and release them. If you know that your anxiety will not let you wait 2 business days to see what was on that report, that's fine. You should schedule an OB, like a regular prenatal visit, on the same day after your ultrasound appointment, and then she can go over the techs can print out the sonographers can print out a preliminary report, so we can go over, specifically what salience you like. If it's last time we didn't see all the heart views, and now you want to know, did she see all the heart views? She can print out a preliminary report. We can answer that question, and then you'll get the full report in the 2 business days. Quest and Natera also have portals too, but sometimes there's, I think the CARES Act, makes them send the results out as soon as they're available. And so they get to you before they get to us. And then you see the report and it's got all this red all over it and it freaks you out. So 1, take a deep breath. Red does not necessarily mean that it is abnormal, okay? Remember that the reference ranges that they use for most of these labs are for non-pregnant individuals. When you are pregnant, there are physiologic changes that mean even though it's outside of the range of non-pregnant normal, it could still be okay for pregnancy. So give us a chance to receive the labs from the lab source, not from you uploading it to the portal, because that doesn't close our lab loops, and we have to close our lab loops. That's important. We need to receive it from them and review it and release it to you with our commentary, which 9 times out of 10 is the ones that say they're out of range are actually okay for pregnancy. One of the most common, now if you've been sitting on your results for over a week and you haven't heard anything from us, then definitely say, hey, did you get my stuff from Quest? Because I've been looking at it. One of the most common reasons, though, that we don't get your labs is if you're using a different name in different facilities. So we ask that you use the same name at every facility and consultant, so that when your reports and consultations come back in, they can sort into your chart. We don't have a fax machine here. Everything goes to the hub in Massachusetts. And if it doesn't have your name and date of birth as what we have in our system, it sits in a limbo box. So we won't even know that it came in. Alternate name use guarantees delays of us being able to review your results. And ideally, whatever name you're using should match what your insurance company says too, because they're always looking for ways to deny that you exist. All right, any questions on how to reach us, any of that good stuff? All right, cool. Let's talk about what to expect at your prenatal visits. So first, expect that you are going to forget all of your questions, which is why text thread. So you want to start yourself a text thread, text yourself all the questions you're going to have. I love it when I do visits and at the end, I do my blood pressure and listen to the baby and all the things on the problem list and all that. And then I say, all right, do you have any questions? And y'all pull out your little phone and you say, actually, I do. So that is my favorite moment. Wear loose, comfortable clothing so that we can access your belly, because we will be listening to your baby's heartbeat at every visit, not doing an ultrasound at every visit, but using the Doppler to take a listen to the baby. We want you to get here about 5 minutes before the scheduled appointment time, so you'll have time to check in and handle any front desk business. And then if you need to leave a urine sample, you'll have time to do that as well. Everybody does not have to do that anymore. We used to check urine on everyone who came in, but now the American College of Obstetricians says you only need to do it in certain cases. So if you've had high blood pressures and we're looking for protein in your urine, or if you've had high blood sugars and we're looking for glucose, or if you've had a recent urinary tract infection and we're checking to make sure that the antibiotics worked. Otherwise, you're pregnant, you've been drinking your water all day. We know you have to go to the bathroom, so come on in and go. If you are 10 minutes late, we will still have time to check on you and your baby, but it leaves little time for questions. If you're 20 minutes late, you've missed the entire appointment. We may be able to work you in later. Front desk is also really good at traffic jams and that sort of thing. They can see, oh my gosh, you're going to miss this appointment with Jordan. There's a spot with Jackie about in 40 minutes. So if you miss your whole appointment and you're able to, wait until Jackie has an opening, we can do that. If that time doesn't work for you, then we can just reschedule to another day that works for everybody. All right, so ultrasounds. When are you going to get another ultrasound? Wasn't that amazing when you had your ultrasound last time? So diagnostic ultrasounds are separate from prenatal visits. The way to know if you have an ultrasound scheduled coming up is to look in your portal. Do you have more than one appointment time scheduled? And is there a provider's name associated with your visit? So Tina Test is my imaginary patient, and Tina logs into her portal and she clicks on appointments. And when she does, she sees that on the same date rather, she has two appointments, one at 9:20 with ultrasound and another at 10 a.m. with Dr. Yeckel. So Tina knows that she has an ultrasound scheduled, and afterwards she has an appointment with Dr. Yeckel where she can get a preliminary report on what was said on the ultrasound. Tina also knows that the full report will be sent to her portal within 2 business days unless there is something urgently abnormal, in which case we will discuss those findings on the same day. So when you're checking out, like let's say you're 16 weeks and we know that your anatomy ultrasound is going to be coming up for your next visit, when you go up to the front desk, be sure that you are getting 2 separate visits with 2 separate times scheduled when you have ultrasounds due. So let the front desk know. We are sending them notes and messages to tell them how to schedule you, but sometimes y'all are fast and you get up there before our notifications do. Um, if you want to look at your baby and we say, hey, you're actually not due for a diagnostic ultrasound, well, that's why boutique ultrasounds are a thing. Boutique ultrasounds are fun ultrasounds. You can go to some of these places in town. These are for informational purposes, not endorsing anyone over the other. But they will do cute stuff like put your baby's heartbeat in a little stuffed animal, do 3D ultrasounds, as we don't have 3D here. But all these cute little fun things that that you can do to commemorate your pregnancy. And you can do this as often as you'd like because there's no radiation in ultrasounds. It's all sound waves. All right, so we have a poll question now about ultrasounds. So when should you expect to have routine ultrasounds? Are we going to do ultrasounds at every visit? Are we going to do them 20 weeks, like your anatomy ultrasound, and 40 weeks, and if you go past? Or do you only get an ultrasound if you have a problem? And the polls are closing in 5, 4, 3, 2, 1, done. All right. Excellent work. Everybody here got it right. So your anatomy ultrasound, if you have a singleton pregnancy, is right around 20 weeks, so 20 to 22. If you have a multiple gestation, if you're having twins, it's a little earlier, of like 18 to 20. So good job, everybody. All right, so next we are going to take a look at our website, fullcirclejax.com, and you're going to let me know when you're able to see that. I'm going to slide that right over here. Okay. Let me know if you are able to. Okay, fantastic. All right, so this is fullcirclejax.com. So all the rest of the stuff that I'm going to go back through, you'll be able to just go to our website and take a look. So we're going to start with the providers. So there's me, there's Dr. Marrow, there's Dr. Yeckel, there's Dr. Mooney. We have midwives, midwife Lauren, midwife Krista, midwife Cindy. I'll come back to Vanessa, midwife Norma, midwife Kayla, midwife Jordan, midwife Brianna, midwife, there's so many midwives, midwife Jackie. And we'll be talking about some changes in the midwives that are coming up. So please tune in on our socials to see what those changes are going to be. But please, these have bios in them, so feel free to read some stuff about us because we definitely are reading stuff about you every day. Over here under patient information, you'll see the obstetrics tab. And you'll know you're in the right place. You'll see the growing belly here and then the baby there at the end. We'll start with our delivery stats. So many of you are here because of our delivery stats, and some of you are looking to avoid an unnecessary C-section, and some of you are looking to have a successful vaginal birth after a cesarean. So our stats are out here back to 2018, I think, so feel free to peruse. But we're going to click on this one, the prenatal care timeline. So this is what to expect at each visit. So if you want to print this out or download it, this will kind of help give you a guide of what's coming up when you're coming in. So everyone here has had their first visit where we did their confirmation with the dating ultrasound. And if you decided to do your blood work on that day, then, excuse me, then you had it done. If not, then you made an appointment to get the blood work done because we now do that here in the office. And these are the standard prenatal labs that we do. You all had a chance to meet with Renee Hall regarding insurance things, and you met with one of the midwives to set your due date. Those of you who opted into doing genetic testing, that would be your first opportunity if you wanted to find out baby's sex, in addition to looking at whether or not the chromosomes were normal. That has to be done at a minimum of 10 weeks. So those who wanted to do it, but you weren't quite 10 weeks at your confirmation, you probably have another appointment scheduled coming up to get that done. If you opt out of genetic screening, the next time to find out baby sex from us would be around your anatomy ultrasound. At this point in pregnancy, we're seeing you every 4 weeks in the office. So roughly 4 weeks after your initial visit, you should be back in the office for your OB physical. These are the standard blood labs. The Pap test is not actually part of the standard prenatal panel. If you're due for a Pap test though, and you'd like to get it done at your physical, more than welcome to get that done. But otherwise it's a standard physical. Breast exam and the pelvic exam, we really only need to collect cultures, cervical cultures. And that can be done as a self-swab if you're not comfortable having a pelvic exam. Those of you who have high-risk issues, after you have your virtual consultation with me, which is roughly 2 weeks after your confirmation visit, we determine whether you need to see the high-risk doctors, and then we send a referral over there when you're about 12 to 13 weeks or so. Then we move into our second trimester. So in second trimester, if you are doing genetic testing, we look to see whether there are any abnormalities with baby's spine with a test that's done between 15 and 20 weeks. At 20 weeks, as we discussed, that's when we do your anatomy ultrasound. You'll also see here in the middle the mental health screen. This could happen as early as your OB physical. Our goal is to get that done by 20 weeks because when you talk to me, I ask questions about your anxiety, depression, history, and that sort of thing. And if we're identifying people, but there may be some who don't have any history, but may just be, pregnancy has a lot of emotional ups and downs. And if there's something we can identify early on in the pregnancy, we definitely don't want to miss it because it can help us get ahead of postpartum depression, postpartum anxiety, postpartum rage. The anatomy ultrasound, as we discussed, is at 20 weeks. And then if you meet with a midwife around that time, she'll be talking about childbirth education and or breastfeeding classes. Then your glucose test is around 24 weeks. And I know I'll have questions about glucose, so we'll put a pin in that and I'll come back to it. My moms who have a certain negative blood type will be making sure that you have RhoGAM to be given before your 30 weeks. This is around the time we want you to tour the hospital. So you'll do your pre-admission forms. Those of you who were with us at Ascension before, remember everything was on paper. It's now online. There's a code you'll scan at the front of the office and get all of those submitted so that they know who you are when you get to the hospital. You'll want to get your hospital tour done. And if you're planning to work with a doula, and we'll talk about doulas in a little bit, you want to make sure you definitely have her locked in by the end of your second trimester. So as we move into third and the longest trimester, figuratively and literally, you have the option to repeat or decline certain prenatal labs. The STI panel particularly, it's recommended to repeat in high-risk populations. If you feel you are not high risk, we do have a form you can sign saying that you don't feel you're high risk and we don't need to repeat it. These vaccinations that you see over here are the ones that are recommended in the early third trimester of pregnancy because they give you enough time to confer passive immunity to your baby during breastfeeding. We don't do them here in the office, but if you want to do them, the midwives will be talking to you and telling you where to go and get them and write prescriptions for them if you need them. First time moms, this is when you start looking for a pediatrician. Many of the offices in town have meet and greets where you can go and find who matches your philosophy. And veteran moms, if you want to stay with the same pediatrician, you want to figure out if that's what you want to do by this time. This is when we start seeing you every 2 weeks. So instead of every 4, it's every 2 now. So moms with certain pregnancy complications will start doing additional testing to make sure it's safe to continue the pregnancy. Around 33 weeks, if we know you're having a belly birth, and that's our term for the gentle cesarean, we start to get you scheduled for that because the calendars open up about 2 months prior to your scheduled date. 36 weeks is when we do another pelvic exam. Group beta strep will tell you what that is and why it's important. And you have the option again to repeat or decline the STI cultures. This is when we start seeing you weekly, so it really gets cozy then. After 36 weeks, when you hit 37 weeks, you are actually full term. It's not your due date, but you are full term. So if you want to bring in your birth plan and start talking about it, then a lot of things are on the table. Start your natural cervical ripening methods, which I'm going to talk about in a moment. And all my belly birth moms moms are off the train by 39 weeks. Typically, we are scheduled between 37, which is full term, and 39. And then if you are waiting for labor to start, be patient, because everyone we like to have delivered by 42 weeks due to increased risk of stillbirth after that. So for first-time moms, 41 weeks and 5 days, we like to schedule induction because it can be slower for you. Your average length of labor spontaneously is about 24 hours. Second-time moms, it's usually about half of that. So second-time moms, 41 weeks and 6 days, just so all passengers are out by 42. So remember, this is out there, and that will remind you of what's coming up at your next visit. Pregnancy safe medications. So my poll says, if you have a headache, are you more likely to take a Tylenol, meditate, or go to the emergency room? And my poll is closing in 5, 4, 3, 2, 1, and done. All right, well, good. Last time someone said they were going to the emergency room, and I don't know what type of headaches she usually has, but that sounds awful. But today we have more meditators than medicators. And I always wonder whether that is proportionate to who is a first-time mom and a second-time mom, because the headaches after you have kids in the house are a little different. All right, safe medications in pregnancy. So this is an alphabetical list of common discomforts of pregnancy, some relief measures. So if you send us a message in the portal, the first thing I'm going to do is ask you, have you tried everything on this site? And I'm going to send you a link to this. And sometimes I don't hear from you after that. Some of you have gotten smart and said, Dr. Adams, I've tried everything on the website and I am still having this problem. So what else can I do? That is actually appropriate use of the portal. So things like constipation. First thing we're going to tell you to do here is, fruits, vegetables, dried fruits, and that. And then we're going to recommend these kind of medications over here. So you can just kind of scroll down. The list kind of goes on: cough, cold, hemorrhoids, all the things, all the sexy things nobody ever said pregnancy was all about. And just know that those are out there for you because all of these things always bother you at 1 o'clock in the morning for some reason. The next box is gestational diabetes screening. And we're not going to get into that right now, but I promise we will come back to it. But just know that this is out here, and it does contain information on how to prepare for the test, like when to stop eating, what not to eat before it, and it gives you your patient-driven alternatives here as well. So remember, this page is out there. We're going to talk about that coming up. Next is weight gain in pregnancy, because some have expressed concern that they have gained too much or gained too little in their first trimester, or even lost weight in their first trimester. So how much weight should you gain during pregnancy? So this is for singleton pregnancies. If you have twins, you can add 10 pounds to the upper number on each one of these. And what I really want to focus on is your rates of weight gain are in your second and third trimester per week. First trimester, everybody's sick, nobody has an appetite, all the things. And so even if you lose weight, don't worry. What we're looking for is your gain in your second and your third trimester. Now, if you are ahead of what you should be gaining for the total pregnancy and you're still in your first trimester, let's definitely take a close listen when I talk about nutrition coming up in the next segment. All right, but just know that this information is out here, and don't judge yourself before you're 13 weeks, okay? All right, birth preferences are out here as well. So first-time mamas, you've never done this before, and it can provoke some anxiety. Sometimes writing down what is important to you, like what's salient to you in a birth experience, can help to reduce some of that anxiety and help with your communication preferences when you're coming in for labor. So a lot of different things on here. Just a couple things I want to highlight. We're still working on nitrous in the year of our Lord 2026. Nitrous is in the building. This is a policy matter, and so we just really need to get everyone trained on the nitrous so that we can start giving it to you during labor. But obviously it's a hospital. We have epidurals, we have IV, and we have tubs for labor. So hydrotherapy, if you are full term and no other issues with the baby, we fill out tubs. You don't have to request them ahead of time. They are disposable tubs. You can take it home with you. But hydrotherapy is available to relieve some of the discomforts with contractions. Other things to highlight: we're not starving you. We're also not strapping you to the bed and making you lie on your back. We encourage you to move around. If you have an epidural and can't move around, we will move you around because we want your baby to be an active participant in labor. You can push in any position, you can deliver in any position. Our standard is delayed cord clamping and immediate skin to skin, early latching. These are the medications that are routinely offered to the newborn. You have the opportunity to come in and talk to your midwife about which medications apply to you. What is this for? Is this important? Should I take this? We do have an option for preservative-free vitamin K at the hospital too. You just let us know ahead of time. So you can see there's a bunch of things. Twins, belly birth, we do general cesareans. So sometimes people think, oh, if I get a vaginal delivery, I get everything I want. In C-section, I get nothing. It's not true. Some of our belly births are some really beautiful healing births as well. So if you know that that's going to be your path, definitely talk to us about how we'll make it awesome for you. 21 boxes, not all of them apply to you. So take one per week, and that's the best way to, I think, kind of break it down and figure out what's going to be most important to you. Cervical ripening techniques that I talked about. So these are things you're going to start doing mostly at 36 weeks, but raspberry leaf tea, you can start as early as 20 weeks unless you're already having preterm contractions. That's the only person I would say don't do that. Or actually, if you're diabetic, and we'll talk about that if you are. In any case, so you can just read week by week what things are recommended here, and you can also see that castor oil is not on here, and you can ask your midwife why she doesn't recommend that you take castor oil before you come in and push in her face. VBACs. Do I have any moms on here who had a C-section before and are looking to have a vaginal birth? All right, cool. So I know for first-time moms this won't apply to you, but I'm always wondering how many VBAC moms. Okay, cool. Polls are closed. All right, so first-time moms, even though you are not looking to have a vaginal birth after cesarean, you are also looking to avoid an unnecessary cesarean. Oh, we had a polling error. Okay, we're going to stop sharing that. Oh, it's still sharing it. Okay, I'm just going to try to delete that. There we go. All right, y'all can't still see that poll anymore, right? Hopefully. Okay, so we'll go ahead and talk about these things that are important for first-time moms and moms who had a previous belly birth. So control what you can. The most common reason that we are doing cesareans is not because baby is too big or because baby is in distress. It is because baby is in a poor position that they get in and they get stuck and we cannot fix it. So control what you can. Try to get that baby in a good position prior to labor. If you had a belly birth before and you're anxious about just trying labor again, you want to look for a fear release method. There's a really good one in the hypnobirthing method for Marie Mongan. But if you're just first-time mom or position was an issue last time and you're seeing a chiropractor, make sure they're Webster certified. You want to do your yoga and Pilates, look for method courses, do your squats. We're going to talk about those in a moment as well. Watch your weight gain, get an experienced doula. This is not the place to cheap out on the doula. We'll talk about spinning babies, and don't get tired and say, well, I just don't want to be pregnant anymore. Just get the baby out. If they're not in a good position, it's not a good idea to just get the baby out, because we will get the baby out. I've never left one in, but it's just a matter of, are we going to get them out vaginally, or are we going to end up in a C-section because we were in a weird position? So trust us, I have amazing statistics. So my goal is not to increase my C-section rate. So if we're recommending something for you, it's because we want you to get the birth safely that you want to have as well. And then lastly, if you had a little guy and you like to have him circumcised, we don't do those in the hospital. We do them in the office before he is 10 days old. So we'll ask you again, if you're having a boy, like right after you deliver, hey, were you planning circumcision for him? And if so, we'll let Naisha know, and she will reach out to you on the portal with his little appointment. And this is information on how to take care of it afterward. All right, so that was a lot of information, but it's all found on fullcirclejax.com, and you'll be able to recreate all of those moments that I just gave for you. All right, so now we're getting into nutrition, as you can tell from this delicious mocha monstrosity that I have put here on the screen. Because some who are saying, oh my gosh, I don't know why I'm drinking, why I'm gaining weight. All I have in the morning is coffee. Is it coffee or is it a salted caramel mocha monstrosity? Did you know that pregnancy only requires an additional 300 calories per day? For twins, you get a little more than that. You get 400. Remember, you get an extra 10 pounds because it takes 10 calories to maintain 1 pound of body weight. And your pregnancy goal weight is based on your starting body mass index, as we saw on the website. So if you're starting the pregnancy at 170 pounds, that's 1,700 net calories to maintain that. And your pregnancy goal weight is to gain 25 pounds. Then that's 250 extra calories. So that's a total of 1950 for the day. And you divide that between breakfast, lunch, and dinner. That's 650 calories per meal. Now, 650 calories per meal is food and drink. So you can't eat 650 and then wash it down with 570 mocha monstrosity drink from the previous slide. And when I say 650 calories, where does it come from? Like, how much should be protein? How much should be carbohydrates? And the quick guide is just kind of dividing everything a little evenly rather. The second part of the slide is just showing how little changes can make a big difference. So switching from regular spaghetti sauce to 20-minute herb-infused marinara may be the difference in sodium intake between your rings fitting and not fitting in your third trimester. So what things should you be eating? You want to eat your fruits, your veggies, your whole grains, your cereal. If you you won't give your baby a nut or dairy allergy if you eat those things during pregnancy, so please continue. My coffee drinkers, you want to limit your caffeine to less than 200 milligrams daily, which is still a lot of caffeine, because please remember, caffeine is a diuretic, and you guys are all going to be pregnant through the summer. So if you're drinking caffeinated beverages, remember, it's making you lose water. You will dehydrate faster. So the 3-to-1 rule is actually preferred for caffeinated beverages. For every amount of caffeinated beverage, you want 3 times as much water, okay? Herbal teas are fine. Our favorites in pregnancy are listed here: raspberry leaf, ginger, lemon, and peppermint. For my vegetarians, my pescatarians, be sure you're getting at least 70 grams of protein a day. Around 70 grams of protein a day. I said at least. I know there are some pregnancy diets that are telling you to cram in 120 grams of protein. Please don't do that. You will grow a 10 or 11 pound baby. 70 grams is perfect for you and your baby to be fine. Normal sized. Deli meat, yes, you can. Just be sure that you microwave it for 30 seconds to kill any harmful bacteria. It does not have to be piping hot out of the microwave, but just be sure that you've gotten your 30 seconds of microwaving in. If your cheeses are soft, but they're made with pasteurized milk, they are fine. If your cheeses are soft and you can't tell whether they're made with pasteurized milk, do not eat it. Canned tuna, you can have 3 4-ounce cans per week if you are pescatarian and you need more fish than that. The FDA has a really nice document. It says 2021, but it's the latest iteration of what fish you want to eat in larger quantities because they're high in DHA, which is good for baby's brain development. Things you want to eat in moderation because they're kind of neutral, and things you want to eat sparingly or avoid altogether because of high methylmercury content. Things you want to avoid: undercooked meats and fish. So if you are a foodie like me and you love your medium steaks, sorry, you have to ruin your steak for the next 6 months. If you like your ahi tuna, sushi, no, that's not for you either. Sorry, cook the fish. For my kombucha drinkers, my kimchi eaters, sauerkraut, any fermented thing you want to limit because the fermentation process is like how we make alcohol. So you just want to limit your exposure to that because we just don't know how different places ferment different things. To that end, you do want to avoid alcohol altogether because we honestly do not know what the safe amount in pregnancy is. And you want to limit your sodium to under 1,500 milligrams per day. If you start reading on the back of packages how much sodium is in things, you will be appalled. And just think back to your spaghetti sauce and marinara, how you could save 500 milligrams of sodium by just switching to delicious marinara sauce. All right, any questions? Yes, finally, we have a question on the board. Some protein powders have bovine colostrum. Is that okay to drink while pregnant? Yes, whatever protein source it is, really the amount, the number of grams of protein is more important than the source for it. Excellent question. Thank you. All right, next, exercise in pregnancy. So it is fine to continue whatever your pre-pregnancy activity was, unless your pre-pregnancy activity was doing nothing. You just won't feel like it in your first trimester. So it's okay. Don't beat yourself up about it. Second trimester is going to bring some physiologic changes that accommodate more activity. So just listen to your body and ramp back up slowly after your first trimester. If you weren't doing anything before, no judgment, little judgment, but it's okay to start a new regimen because remember, a sedentary lifestyle leads to a malpositioned baby, which increases our risk for cesarean delivery. For those of you with these cute little Fitbit watches who are tracking obsessively your heart rate and giving you new reasons to be anxious, your resting heart rate is going to go up by 10 to 20 beats per minute. That's normal. It's physiologic. If you're not getting lightheaded or dizzy or passing out because of it, then don't stress yourself about that. If walking is your exercise, and I do see the question out there, but I'm actually going to talk about that in just a moment. If walking is your exercise, then be sure that your heart rate is hitting 70% of your maximum heart rate, and the max heart rate is 220 minus your age. So let's say you're 30 years old. You should not be exercising for extended periods of time with your heart rate above 190. 70% of 190 though is 133. And so if you are walking, if your heart rate is between 133 and 190 for 30 minutes, 3 times a week, that's aerobic exercise. Way to go. If when you're walking, your heart rate is still hanging out in the 80s and 90s where it always is, that's transportation, which is also important, but it's not aerobic exercise. So perhaps we will introduce some treadmill, some elliptical, some running, some swimming. Yeah, y'all are pregnant during the summer. Absolutely swim. It makes your belly weightless and your joints feel amazing. And the cardio is fantastic. If you have an indoor bike, I'm trying to get back on my Peloton. If you follow me off my meds 8, I'll follow you back and you can see how abysmal my workout routines are. If you're a weightlifter, you can lift up to whatever you were lifting pre-pregnancy level. You don't need to increase your resistance during pregnancy because your body and your baby are going to be doing that. If you're an experienced squatter, continue squatting at whatever level and try to add some more. If you are not an experienced squatter, please start. This is my favorite pregnancy exercise. At 20 weeks, you give me 5 a day. 21 weeks, give me 10 a day. 22 weeks, give me 15. Build up to a minimum of 15 per day because that will help to open up that pelvis and let that baby descend in the proper orientation. Pilates and yoga are also 2 of my favorites because, again, opening up muscles and ligaments and getting everything long, lean, and ready. And any experienced instructor will be able to tell you what the pregnancy modifications are. So the things that you want to avoid: high intensity interval training after first trimester. So it's not the interval, it's the intensity. You can do the low impact version of these exercises. Anything that has you lying flat on your back, like excessive ab work, you can do ab work, but just the standing and side lying abs are preferred. Hot yoga, which is what answers the question that's up here right now. So hot yoga, if you're a hot yoga instructor and you're fully acclimated to that environment, you'll probably be fine. But because pregnancy comes with so many fluid shifts, you're very likely to get really dehydrated and dizzy during it, and we just would not want you to fall on your belly and harm yourself or your baby. Scuba, because of barometric pressure changes, you want to avoid that. And same thing with high altitude hiking, decreased oxygen. 8 to 10,000 feet above sea level is where we usually say you're okay to just hang out, but nothing strenuous. So if you have family in Colorado, go ahead and visit them. Just don't go hiking with them at 8 to 10,000 feet. Contact sports, please do not take up kickboxing at this point in your life. Hold that until postpartum. We've also had some weird pickleball incidents with contact sports, so with a ball flying at you or your belly. Just maybe we hold that until after pregnancy. And then outdoor biking after 16 weeks isn't a no, it's just a be careful because your center of gravity shifts at about 16 weeks. So as you're starting to turn corners and go around curves, you may notice that you're doing more falling over than actually hitting that curve the way you meant to. All right, so now that we have talked about exercise and we talked about nutrition, here's a question about gestational diabetes, because I did tell you that we were going to, okay, I'm not sure. All right, yes, maybe this is out there. Are you able to prevent gestational diabetes with diet and exercise? I don't know if you can vote on this. This isn't making me This isn't allowing me to share the poll anymore. All right, it's saying that a poll has already been shared in the meeting. So I don't know if it's still sharing the last one. Oh, no, it's still giving me an error from that. Can you all still see the old poll? Put your thumbs up if you can still see that there's a poll up there. It's not letting me stop sharing it. Okay, all right, guess what? No more polls today. All right, so surprise, no, you can't prevent gestational diabetes with diet and exercise, because your number one risk factor for gestational diabetes is having a placenta. You know how we blame our hormones for like everything else during pregnancy? Same. So gestational diabetes happens when your placenta gives off hormones that tell your insulin not to do its job. The job of insulin is to clear your bloodstream of glucose, bring it into the cells to use for energy. If your insulin is being told by your placenta, hey, you don't have to do your job, call in sick today, then you have excess glucose that's circulating in your bloodstream. That's diabetes, but it's diabetes because your placenta is telling your insulin not to do its job. So if you are doing this pregnancy without a placenta, then I don't have to screen you for gestational diabetes. But hey, twin mama, if you are doing this pregnancy with two placentas, I'm definitely screening you. For my moms who say, but I never eat anything with carbohydrates, like, you eat good carbs. So eat your fruits, eat your whole grains. Don't skimp on those prior to the test, because you don't want to you don't want to fool the test or try to fool the test and end up failing it actually. If the actual drink ingredients are what bothers you, we have lots of alternatives. Remember that link that I clicked on? I said, this tells you how to take the test and what the options are. So your options here, you can have soy-free, dye-free, gluten-free, BVO-free, kosher, vegan. So the Simply Pure drink is what we have available here in the office. There's also Fresh Test, Glucorganics, and glucose tablets that you can bring in. So those links are on our website. Definitely take a look there and order them at least 4 weeks before you're supposed to take your test, because a lot of times they're on back order. Once you are ready to go into labor, you want to be prepared. So childbirth education classes, these represent these represent method classes. So hypnobirthing is on here, hypnobabies, I think Bradley method, maybe even Lamaze is here. But if you search any of these, the matrix will figure out that you're looking for a class, and they will start showing up in your social media feeds. Breastfeeding classes, La Leche League has them. Also, HCA has Sonia, who is amazing. She's an IBCLC who does breastfeeding classes that you can also sign up for on the HCA website. Every new parent should know CPR. Here is a link to do CPR. Even if you already know adult CPR, infant CPR is different, and a refresher is always very helpful. Chiropractic care. So we talked about Webster certified chiropractors. They have a special certification that accounts for the different adjustments that your body goes through during pregnancy, to make sure that the adjustments that they do are safe for you and for your baby, and encourage your baby to get into the right position. The next poll was going to be about who uses a doula, but we're not doing polls today. So we're just going to talk about doulas. Why do you need a doula? You already have a midwife and a doctor and a nurse and an anesthesiologist possibly, and a CRNA. It's a whole team, like you're going to the Oscars. But doulas are there to provide emotional and physical support before, during, and after pregnancy. So this includes like reminding you how to breathe. You know, who forgets how to breathe? People having contractions, that's who. Putting you in different positions to help your baby to move into the pelvis appropriately. Relaxation strategies during labor. They're not clinicians, so they're not going to give you medical advice or provide medical care, but they more help you process your feelings about the medical advice and medical care, and help you to communicate with us how you're feeling about the medical advice and medical care that you're getting. They don't prescribe medications, and if you call us in time, get to the hospital in time, they don't deliver your baby. They don't want to deliver your baby. All the doulas that I know desperately do not want to deliver your baby. If you want to know who the good doulas are, please ask the midwives, because they're the ones who are first line working with the doulas all the time. They can tell you whose work they've seen and appreciated with our mamas. Acupuncture and pregnancy massage are also recommended. They help with baby's positioning, lots of different discomforts, nausea, back pain, all that sort of stuff. So just some of them require letters. So you can send a message and Naisha will forward you our form letter saying that massage is fine. Typically, people will only do them second trimester and up, and so we have a letter for that. Many of your insurances do cover breast pumps. So when you're around 20-ish weeks or so, come into the office for your visit. In the room, there is a QR code that you can scan to get your breast pump. Please don't go looking for your own company that provides breast pumps, because a lot of them, like inevitably, I get messages from people, they sent the prescription and I can't find this and I need more information. This company makes it very, very easy for all parties involved. You put in your insurance info, they send you what your insurance covers, they write the prescription and send it to us, we sign it and send it back. You have your pump within 3 weeks. For those who need to use the Family Medical Leave Act to take off time for bonding with your baby, we do this through a third-party company called Leave Guru. If you've ever tried to get FMLA paperwork filled out before, you know it can take 2-3 weeks. Most of these are completed in less than 24 hours. So Kylie, again, is the person to help you get registered with Leave Guru. And then after you deliver, because you will deliver, blood pressure checks for anyone who's had any issues with gestational hypertension, and for everyone, for first-time moms, even if you've never had an issue with high blood pressure before. Remember, that placenta is in there doing stuff. So it is giving off hormones that can increase your risk for getting high blood pressure, even if you've never had it before. About 8 to 12% of you will actually develop high blood pressure at the end of pregnancy. And it's not a judgment on your lifestyle, it's your placenta. For those who had a belly birth, incision checks are usually done about 2 weeks after delivery. Routine mental health screening, 80% of you will develop baby blues, which is a normal hormonal adjustment in the first 2 weeks after delivery. If it persists beyond 2 weeks, we may be looking at postpartum depression, postpartum anxiety, postpartum rage, and again, we want to get ahead of those things. Postpartum doulas are angel people who exist in the city who, for a fee, will come over and take over all of your night feedings and let you sleep, mama. If you want to find out who the postpartum doulas are, when you come out of the bathrooms in the front, there are business cards in the front and there's information about postpartum doulas on there. The motherhood space is a tremendous resource. Jacksonville is one of 5 cities in the country that received a grant to take care of our postpartum mamas. I'm really proud of our city for that. It is a joint venture between the Winston YMCA and some of the psychologists at Downtown Baptist. They have light therapy, yoga therapy, childcare for babies 6 weeks to 12 years old, and it's all covered by either insurance or the grant, so no cost to you. If we identify in a routine mental health screen that you're a candidate for the motherhood space, we will be referring you there. And then pelvic floor therapy, which is standard of care in many countries. In America, we're trying. I have a nurse who comes in here 3 times a week. Tracy is here on Tuesdays, Wednesdays, and Thursdays, and this helps with pain of vaginal lacerations after delivery, pain with intercourse, leaking urine, all of these things that we don't really give a lot of spotlight to after delivery, but you don't feel the same after you have a baby, and that's after a belly birth or a vaginal delivery. So random frequently asked questions before we get into our last home stretch. You can sleep on your left side, your right side, or your back. Yes, you can. If sleeping on your back makes you dizzy, though, you can use one of those wedge pillows you can get off of Amazon to just tuck under your hips so you're not completely flat. You can help paint the nursery. Just be sure you're in a well-ventilated space. You can take probiotics, prebiotics, postbiotics, all the biotics they've come up with, y'all. You can dye your hair, including your eyebrows. You can do gel nails, but if you're going to be sitting in a salon with heavy fumes for a while, you may want to wear a mask just so you don't get dizzy and pass out. Car travel, you guys are going to be pregnant during the summer, so if you need to vacation, car travel is fine up until full term, 37 weeks. Twins, you may want to check in with us before you do that. It's not that it's not safe after 37 weeks, it's just that your baby doesn't have a calendar. And if you go into labor when you're in Minnesota or wherever it is you're going, full circle is not there, and that is not what you want. Be sure if you're traveling in a car, you're getting out and stretching every 2 hours to prevent blood clots. Skincare, you can use your salicylic acid, your benzoyl peroxide, just nothing that has retinol in it. So bakuchiol, Bakuchiol, is an alternative with vitamin A that's not harmful to the baby. Flying, for my twins, it's okay up to 32 weeks. And for my singletons, it's okay up to 36 weeks. But please wear all the compression hose, drink all the water, do all the calf, toe raises to exercise your calves to make sure that you are not developing blood clots while you're on the plane. Question I have up here: when is it important to start getting up and moving during travel? Throughout all of pregnancy? Yes. So your increased risk for blood clots started from the moment you had that positive pregnancy test. So anytime you are going on long trips at any point in pregnancy, that is what you want to do. My summer crew: no roller coasters, no water slides. Somebody asked me to, no jet skis either. Okay. All right. Last thing. Upper respiratory illness updates. These are all very current. With regard to the vaccinations I mentioned, in third trimester, ACOG moved from supporting either way to strongly recommending, specifically for COVID, based on New England Journal of Medicine studying 35,000 pregnant women who received it. Moderna and Pfizer are okay if you intend to get a booster. We don't recommend Johnson & Johnson because it has an independent risk of blood clots. Your booster recommendations: all the vaccines are approved for boosters. If you're more than 6 months past the Moderna or Pfizer, you can get another one. If you're more than 2 months past the Johnson & Johnson, you can get a Moderna and Pfizer because mixing and matching is okay. If you're getting your RSV, your flu vaccine, your Tdap, you don't have to time it against those because they all work differently. If you do get COVID or any other upper respiratory illness, flu is huge right now. We're getting out of this season, hallelujah. There are no formal recommendations for the medications you see here. The ones that we do recommend are vitamin D3, your zinc, your vitamin C in these specific doses. If it's COVID specifically, because COVID has been linked to increased risk of gestational hypertension. And people are saying, oh my gosh, there's so much more high blood pressure at Full Circle. It's because a lot of people had COVID during their pregnancies. We recommend starting a low dose aspirin at the time that you get COVID, unless you're more than 36 weeks. But that will reduce your risk of conversion to gestational hypertension in pregnancy. And please don't come in here and get my staff sick because we need to be able to take care of you, and we can't do that if we can't be around you. Also, you'll be coming into an office full of immunocompromised pregnant women. Please don't do that. Just do a virtual appointment. We'll check on you, send in anything you need, but just please don't put everyone else at risk if you have a contagious upper respiratory infection. So supportive therapy at home. The website has information on what you can take for sore throat, congestion, all that stuff. You only need to go to the hospital if you're having difficulty breathing or you have a fever that you can't break with the normal amount of Tylenol. For those who had your last baby during the height of COVID, take a deep breath. It's better now. We're back to having 4 visitors, so everyone can have 4 visitors in the room. You can't, for biological children or your own children that you claim adopted children are welcome to be in the room as long as there is an adult there to take care of them. Your doula doesn't count as one of your visitors, so if you need your doula there too, and you also have 4 family members, it's fine. We're not masking routinely in the hospital anymore, only in labor if you screened or test positive for COVID, RSV, flu, anything that can get the nurses who need to take care of you sick. And even if you are sick during labor, moms and babies are not separated. We give you an N95 mask and we give baby an isolate to protect so that you can still continue to breastfeed. The last thing was supposed to be a poll question, but I know all of you would have gotten it right. So I'll just skip to telling you that we are on all the social things. As I mentioned, we are going to be coming out with a podcast series around the International Week of the Midwife to discuss some of the midwife changes that we're having here. Don't worry, we're still a midwifery model practice, and you'll still be delivered by midwives and be getting care from them. But we're going to be making some changes to how we deliver care that will hopefully improve everyone's experience here. So thank you all so much for your time. I don't see any other questions there on the floor, but I do appreciate y'all hanging with me through all the technical difficulties, and we will look forward to seeing you back in the office very soon. Please know that if you have any problems during your pregnancy, if at any point something in the pregnancy does not match up to the energy that I'm giving you today, please reach out to me personally. Going to Google, going to Yelp, those will not solve your problem. This is my practice that I started 12, 13 years ago. And so coming to me will help you solve your problem and help us to improve too, because I want you to have a wonderful pregnancy experience. Okay. All right. Thank y'all again for your time, and we'll look forward to seeing you back in the office real soon. Mwah.